Hello, and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
Hello and welcome back for another episode of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami, and I am super excited to be here with someone who I admire and look up to, and I've heard fantastic things about, Dr. Mark Hassad. Dr. Mark Hassad graduated dental school in 1980 and is currently a lecturer around Australia and around the world under the Relax Dentist brand, and his work is focused around the art of case acceptance. So Dr. Mark Hassad, thank you so much for being on here. I'm a big fan of yours. All my classmates from Melbourne Dental School all rave on about you and your work and the things that they learned from you for case acceptance. So I really appreciate you giving me some of your time here, and I'm really excited to talk to you. So if you can just go into a bit of your background about yourself, and then we'll sort of jump off from there.
All right. I suppose you introduced me as case acceptance, and that is probably the biggest thing I do. But my greatest interest, what really led me into case acceptance, was efficiency. I just love working efficiently. That's really what I love. And one of the things that I noticed when I first got out was I was spending this huge amount of time trying to explain treatment to patients. It just goes on and on and on. And then at the end they go, I'll think about it, and they walk out of the room. And you realise you've just burnt 25 minutes for nothing, sort of thing. So that offended my innate sense of efficiency, plus, it's just not a good use of my day. I'd rather be playing tennis or something, So I started thinking about it, and I realised the missing piece in the puzzle with efficiency was the ability to communicate really rapidly with patients.
Yeah.
And it's just amazing. Once you get that key, once you know how to unlock that key, it's incredible the stuff it does for your practice. It's incredible how things open up. A friend of mine a while ago attended the course, and this guy talks too much. He just talks on and on and on at patients, right? Like half an hour or whatever.
Yeah.
And so we practiced, shortening it down, and just getting a case presentation down to, 60 to 90 seconds, right? 60 to 90. That's the goal, to get it in that time frame. And anyway, he went back to his practice and presented a $68,000 case and got acceptance inside 90 seconds.
That's incredible.
It was just, he was blown away. But his comment was, shutting up hurts so bad. And I said, well, go have a coffee, you got the acceptance, forget about it, go have a coffee.
That's awesome. So I watched a few of your videos that you've posted up, and I saw that you had that first big case that you talk about. You're fresh out of school, you're working, and the patient comes in, they have a lot of work to do, and you're talking away. And at the end, you arrive at a price point of, $6,000. This treatment is going to cost $6,000. And then you keep talking, and then you drop it down to $2,000, and then still the patient's not happy, and you don't get that acceptance. So how did you go from there to where you are now? Obviously, I know you've mentioned you love efficiency, and that was like the driving factor there. But in terms of practicality and application, what tips would you have for someone who's like just starting out work, and now they're realizing, wow, that case acceptance and patient communication side of things is like more important than maybe my clinical skills, because I'm not going to get to do any of the cool things I'm learning if I don't know how to get patients to find value in it and accept it.
Yeah. Well, one of my, I suppose he could be a mentor, but I never met him, but I met his influence through the dental career was a fellow called L.D. Pankey, who founded the Pankey Institute down in Miami, Florida. Very, very influential dentist. He died a couple of years before I visited the institute. But the thing with Pankey was he said that the basis of a successful dental practice is your ability to communicate. Now, I think that's so interesting, because at his Institute, they teach marvelous restorative dentistry and all the techniques for occlusion and, how to prep teeth and, all this sort of stuff. And yet here's the guy who's the guru with this fine quality dentistry. And he says the basis of your practice is your ability to communicate. So really, it's the first thing is to have that realization. I mean, I visited a dentist a while ago in Sydney, and quite a prominent dentist in Australia, and had marvelous technical skills. I mean, he almost had sparks coming from the ends of his fingers. He was so, skilled at technical dentistry. He knew occlusion, he knew perio, he knew implants, he knew crown and bridge. Like, this guy knew everything, and his practice is just mediocre, like barely mediocre. And why is it mediocre? Because he can't express himself to patients. That was it. So if the young dentist, the first thing is to get that realization that that's going to be the key that will unlock your practice. So once you've got that realization, then what you need to do is start pursuing the knowledge. So you start getting out there. And I mean, yesterday I flew up to Brisbane and I was presenting to a group of dentists in Brisbane. I said, you guys are so lucky. Like, here you are sitting in your hometown. I've come to you. I'm giving you a presentation about all this stuff. I had to fly to, Utah. I had to fly to Phoenix, to get this stuff. It's just ridiculous. And now, it comes to you. So, I mean, the realization is the first thing. I need to know how to communicate. Then you've got to get the knowledge, and then you've got to apply the knowledge. Because, I mean, I've given, now this seminar to literally hundreds of dentists, and some of them make an incredible success with it and just go from leaps and bounds. And others just sit there and they drop back into their bad habits and and they stay where they are, or they're good for a while, and then all of a sudden they start drifting back, and drifting, and then their boss gets me in again and they go back up again, sort of thing. So realization, knowledge, and that discipline to stay with the good habits.
That's awesome. And from your experience, if someone's listening right now and they're just looking for 3 or 4 quick things that they can try out, because this is something that when I graduated from school, and generally speaking, like, I thought I was pretty comfortable talking to patients and pretty well. Like, I felt like I was a good communicator. So when I started seeing patients, I was talking well. My eye contact is good. I'm building rapport. But it wasn't like translating into case acceptance for what I was hoping to do, and so I needed to find ways to refine it, right? And so I started reading articles and some books and everything and podcasts, and try and pick up key phrases or sentences or ideas. So from your experience and from your sort of approach to things, what would you say a good starting point would be? Like, if someone wants to implement something tomorrow after listening to this podcast, what could be something that you would recommend they try?
Well, one of the first things I'd say would be that stop trying to teach patients dentistry, right? They're not interested. Yeah. They do not want to know the technique of how root filling is done. Imagine if you took your car to be repaired, right?
Yeah.
If you drive, it's running rough, you drive it into the repair shop, the guy looks at it, all you want him to say, it's the gearbox. I need it for 3 days. It'll cost $1,200, right? And you'd go, that's it. See you in 3 days, and you'd be gone, right? Instead of that, like, if the mechanic was a dentist, he would put up a wall chart and start saying, let me show you how a gearbox works. This is the wheel that spins around, and you'd look at the guy and go, are you mental? Like, stop this. Just, But dentists, we get in there and we show the patients cross sections of teeth, and this is where the retina goes, and this is how we prepare. And we think that helps, and it's just absolutely crazy. So the first thing I'd say is stop trying to teach patients dentistry. They are not interested. They don't want to know. So if a patient said to me, "What's a root filling?" Right, very simple question that they might ask. I need a root. What's a root filling? What we do is we clean out infection and we seal up the root, and that gets rid of your pain.
Easy.
That's the total explanation, right? Yeah. How long did that take? Like, that was about 15 words and 4 seconds, right?
Yeah.
Instead of that, you ask the average dentist what a root filling is, and 15 minutes later, the nurses are standing by the door going, "Doctor, doctor." So the first thing is I'd really get rid of all that extraneous detail. And then what you've got to do is make the decision simple for patients. And the way you make it simple is by offering two very clear choices.
Yeah.
So many people, have you watched the film The Matrix? The Matrix is an all-time classic film, Lawrence Fishburne and Keanu Reeves, right? And in that film, Lawrence Fishburne holds out his hands and says, "Which pill do you want, the red pill or the blue pill?" Right?
Yeah.
And Keanu Reeves is, "I'll go for the, which I can't remember from the film which one, but picks one of the, it's a very clear choice, right?
Yeah.
But if dentists were doing this, they'd go, "Well, do you want the red pill or the blue pill, or maybe the purple or the yellow, or what about the green?" Right? And all that does in the patient's mind is it introduces this sort of doubt and spinning and all this sort of stuff, and then they can't make a decision. So you've always got to just make the decision clear, clear option, red, blue, and that's it. So someone comes in with a broken tooth, right? What are the choices? We can fill it again, or we can put a full coverage restoration, something indirect on it, right? A crown, let's say.
Yeah.
So red pill. Okay, Mr. Patient, what's happened is the tooth is weak, and that's, it's been nearly all filling over years, and that's why it's broken. So you've got two choices. One is we can take the old filling out, refill it again, which is quick and cheap, but the risk is it's going to break again. Or the other thing is we can put on the tooth what we call a crown, just a cover over the top that holds it together. Now, drawback with a crown, it'll cost you more, $1,650. But the plus is you get a really strong tooth that's much less likely to break. What do you want to do?
That's perfect.
That's it. That's the presentation for the crown, right?
That's incredible.
And you listen to that. There's no technical details, none. Like I'm not explaining, well, we take the burr and go, around the, So there's no technical details. It's just very simple. Red pill, blue pill, cheap, quick, not so strong, more expensive, much stronger. There is the choice. And patients, when they hear that, they go, okay. Basically, if they've got the money, they'll have the crown. If they haven't got the money, they'll go for the filling. But you know the answer in less than 1 minute, don't you?
Yeah, that's perfect.
Where, instead of we get all this bogged down with we've got to explain this and explain that, so that'd be my thing, like stop the technical detail and give a very clear choice between two options.
That's interesting. And it's funny because you mentioned like a mechanic in your example, which just made me think, I know like unfortunately dentistry has like a bad rep sometimes, and patients nowadays maybe like not as trusting of dentists as it maybe in years past. So do you think this type of case presentation like enhances the trust because you're being very like clear and direct and you're not kind of jumbling around words trying to explain? Because in my mind, maybe, or in a lot of people's mind, if you explain things like really thoroughly, you're showing that it's like a genuine issue and that you're not sort of, just making things up or overselling or anything like that. What's your thoughts on that?
Well, I think we've got a couple of issues there. One is there is an issue of trust, but trust can be gained very quickly, and it's how you carry yourself, how you present yourself, the intensity with which you examine the patient, the seriousness with which you regard their problems. I mean, once people know that you're really sort of serious and interested in them, that they relax and they become, much more trusting. A while ago, I had a problem with this eyelid, sty there. I went and saw an ophthalmologist.
Yep.
And this guy was great. He came out, greeted me in the way, "Hi, Mark, thanks for coming," shook my hand, "Come in, have a seat," And so he just had this sort of manner, this aura about him that sort of, and then he was absolutely focused on what the issue was. So he was almost so intense. He's leaning forward in the chair, and you could just see, like this.
Yeah.
And he listened to what I had to say. He examined me. He looked at it. And then when he spoke with this total authority because he'd done he'd listened, he'd examined, And then he spoke with this complete authority about what needed to be done. And, honestly, I just thought, well, I was eating out of the palm of his hand, because the trust was there.
Yeah.
But so many people are sort of like trying to prove something to the patient. They do it by this excessive use of details. And here, let me show you this X-ray. See this tiny little black thing here? That's a hole, right? And it makes it worse, not better. It makes it worse because they've got to take your word that that's a hole. They don't know what a hole looks like on an X-ray. Have you ever been there? You're explaining something. Well, of course, I'm pretending to hold up an X-ray, but nowadays they're all on the screen.
Yeah.
But, have you ever been explaining something on an X-ray to patients and you're going, and see that hole there and see this little black area up at the end of the root and all this sort of, pointing all this stuff up. And after about 5 minutes of this, they look at it and go, what are the white things?
It
and
does
you
happen.
suddenly realise that none of it has gone in. It's all been a total.
It makes you feel better.
Yeah, well, it makes you're trying to prove yourself.
Yeah.
And meanwhile, you're actually making it worse because they're now doubting you. They're now sort of, not sure about you. So, you're actually making it worse.
That's amazing. No, that's so valuable. And I think I've heard about your methods, obviously, from your previous podcast and from talking to my friends. So I've tried to incorporate it a little bit, like, red pill, blue pill type thing. But I still catch myself sometimes rambling and pointing at the X-ray and this and that. But like you said, everything is a habit, right? You have to sort of keep at it, and over time you'll become more natural doing it. So another area I wanted to talk to you about is it's big for new dentists as well, is building rapport with patients. So obviously this comes before what we already talked about. So you meet a patient for the first time, new to your practice. What do you, because I find, I like to build rapport, but I think I maybe overdo it sometimes where I'm I'm becoming a friend versus, I think I sometimes maybe cross that line a little bit too much. So what would you be a recommendation for building rapport with patients and keeping it professional at the same time?
Well, my recommendation, actually, I still practice a bit, and so I do that so I can keep relevant and try experiments and all this sort of stuff.
Yeah.
And on this experiment about rapport, I thought I'd conduct this little experiment a while ago, and it was how little I can talk to a patient about non-dental things and actually get rapport. So I thought, I'll see if I can cut my non-dental conversation to zero, right? Now, I guess you've got to say the word hello when they walk in, right? But anyway, so what I did was when they walked in the door, I put out my hand, good hand, you've got to know how to do a good handshake.
Yeah.
I'm sure it's the same in Canada. The cultural norm in Australia is we say hello with a handshake.
For
and
sure.
I'm sure that
absolutely.
Yeah. So you put out your hand, vertical, nice, meet the hand well, good handshake, good eye contact. Hi, my name is Mark. Thanks for coming. Have a seat, right? That's the introduction. So I guess that's non-dental, but you've got to say hello to them, right?
Yeah.
But anyway, then I come around in front of them and I look at them intensely and I say, now I believe you're here today because you've broken a tooth on the lower right. That's it. Right?
That's your report.
And we're away. We're into the treatment, right?
Yeah.
And I could not notice any difference at all between doing that and going, and tell me, what sort of day are you having? We've been having a bit of weather lately, haven't we? Like all this stuff, which is really just irrelevant, isn't it? It means nothing. So it was just. Yeah, it was so interesting to me to see that you can just cut out all this stuff. Now, I have to tell you this story about it. There's 2 bakeries near my house, right?
Yeah.
And one of them, you walk in there and they're nice and they smile and say, hello, what do you want? And, I'll have a loaf of wholemeal bread slice. So they get it for you and hand it to you and pay the money and you go out, right? Pleasant interaction.
Yeah.
And the other one thought that they're going to build their business by chatting to you, right? So you walk in there and it's, how's the family? What are they doing? And what are you doing on the weekend? And I'm looking at him going, shut up and give me my bread. And as dentists, we think that they're there so we can ask them what they're doing on the weekend. oh, please, like, so you and your listeners should Google creepy girl meme, like, and it's you'll get this picture of this girl,
Yeah.
and it's a bit like most dentists, creepy girl meme.
I'll look it up.
And it's most dentists are, when they're trying to build rapport, they're like a little puppy dog with the tail wagging.
Yeah.
Like, oh, and you go sailing, do you? Oh, sailing, I love sailing, Give me a break, like,
I'm laughing.
Oh, really?
I'm laughing because like that's exactly what I do. So I'm embarrassed. I'm definitely that second bakery. So.
Right, okay. Yeah. Well, we started, even though the one where they're all sort of, asking us what we do on the weekend, even though that one was closer, we actually now walk to the further one because we're just so sick of it.
That's amazing. So so you build the rapport, you get the case acceptance. Where did you, when you're a young dentist, where did you develop that comfort level with like the bigger price points on some treatment plans? Because obviously, you come out of school, you can see a patient and they need a, like you said, $1,600 crown. In the back of my mind, I'm like, oh, I can't afford that myself. So how can I expect them to like afford it? So what do you have and what recommendations do you have for someone to overcome that initial like price barrier in their own head so they can just present it very comfortably and confidently?
Yeah. I mean, it's interesting. I've been in so many practices watching so many dentists work with patients, and dentists have two big fears. The first one's rejection. The patient says, nah, forget about it, just pull the tooth out. So that's their first fear. But their other huge fear is money. They're just terrified about money. They just can't bring themselves up. And I can really relate to that. Like when I started my first, my own practice, crowns were $640, which tells you how long ago it is. But anyway, so a patient would say to me, how much is a crown? And I'd go, $490. Right. And I'd be all nervous and my body language, and all this sort of stuff. And I just discounted the crown by $150. And I'd go, oh, why did I do that? And the patient would read my body language and go, wow, he must be overcharging, like, so it was, even though I was undercharging, it had the reverse effect. Because they don't know. They just judge whether your fee's fair by your demeanor, how you are when you present it. So I really say, there's a few things. You need to keep your voice. You need to have good eye contact. Always, when you're talking with someone, you look at them in the eyes, you look away, you look, you don't have continuous eye contact.
Yeah.
But the one time I will always be looking someone straight in the eye is when I say the fee, because I want them to know that I mean it. I'll say it's $4,800 and look them straight in the eye because I really want them to know I mean it. But the other thing is, it really is just practice. I mean, how I got over it was just by doing it. And I say to dentists, well, all dentists, but particularly young dentists, it only hurts the first 200 times.
Yeah. So we'll get over it.
And after the first two, so just get out there and tell a patient it's $19,300, right? And you go, oh, and you die inside, right? Yeah. And then you just do it and you do it and you do it, and it only hurts the first 200 times. But, we really do have to get over it because patients don't have this hang up. I mean, they walk into a car dealership and they say, that's a nice one. How much is that? And the salesman looks them in the eye and says, it's $44,000, right? Well, that's... But imagine if they were a dentist, and the patient says, how much is that? And the dentist goes, no. Go and ask Melissa over at the desk. She might know, it's ridiculous. Yeah.
That's interesting.
Yeah,
and
it only hurts the first 200 times.
And what's your thoughts on, I know in Canada here, and I'm sure in Australia as well, certain offices, some bigger offices, practices, they have like an office manager or like a treatment coordinator that discusses the money with the patient. So the dentist themselves they treatment plan and then they don't have to discuss any financials with the patient. What do you think about that? Do you think that's a good idea or it's a bad habit for, like an associate dentist to rely on like a treatment coordinator? Because once they go on their own and open their own practice, then they're going to run into that issue.
I think it's a bad idea myself. I mean, if it only takes 60 to 90 seconds to present the entire treatment plan, including the fee, why wouldn't you do it? Like, this is how long it takes. Let's say I'm going to present a fee that's $55,000, right?
Yeah.
So I go through the treatment explanation, right? This is how long it takes me to present the fee. And so it's $55,000.
One sentence, yeah.
So why wouldn't you do it? You know, like, it's just so simple, right? Mm-hmm. Now, the problem is, right, you've taken the patient through all that explanation, right? And if you say, oh, now I'll get Mary to come in and she'll explain to you how much it costs, right? So in comes Mary and she says, and it's $55,000. And the patient goes, oh my God, 55, there's no way I can afford that. But you've left the room and you're working on your next patient.
Yeah.
Well, what does Mary do? You know, I'll just cross out these item numbers and these item numbers. And, you know, like, what does Mary do? She's right. in between a rock and a hard place. That's Whereas right. if, you know, she says, oh my God, I can't afford 55. You go, okay, can you give me some idea what is financially feasible for you? And we'll try and work with that. There you are, you know, so you're still in the room and you've still can, you know, work out a suitable treatment plan based on their finances. Yeah. So, yeah, I'm not a big one. But, I mean, the reason treatment coordinators exist, or these people who come in, you know, do the closing for the dentist, is just the dentist has never got comfortable with their fees. So they can't say the fee. Yeah. So they'd rather just sneak out of the room and bring someone else in to say it, you know, like that's really it. But yeah, just get comfortable with it. Like, don't worry. I mean, it's money, you know, like, I mean, what is it? You know, you go and earn some more. I mean, a friend of mine bought a Mercedes S-Class, right?
Yeah.
You know, S-Class Mercedes. You know, don't know how much it is in Canada, but in Australia, it's $280,000 on wheels.
Cars are super expensive in Australia.
Yeah, super. So $280,000 on wheels. So he drives it out of the showroom. He's lost $50,000 driving it out of the showroom, right? You know, but he does it again a few years later. Like, we just got to get over it. You know, like, people pay for things they value, you know, and if mainly, or if they don't have the money, you just work within that budget. But it's, yeah, we've just got to get over our fear of the fee, really.
Yeah. And you just said an interesting point. They got to appreciate the value of what they're getting. So do you find, you know, in such a short, case presentation, patients like understand that value of what you're providing? If they're, you know, they've neglected everything for a while and they come in and they have that, you know, full mouth of work that needs to be done. How does that value building work in this system?
Yeah, well, we've sort of jumped to the end, which is the case presentation. But there are actually 3 steps that lead up to that. And we sort of jumped to the end. So you've heard the end of the process, but the steps lead up to it is rapport. You've got to get the trust from the patient.
Yeah.
Then you've got to analyse the situation, what's going on in their mouth, do all the dentist stuff, you know, tapping on teeth and x-rays and, you know, all our dentist stuff. But also, as you analyse that situation, you have to agitate the patient because they've walked in a state of complacency. They haven't known what's going on in their mouth. You know, they've got a lower 6 with a huge alloy restoration in it, and they've just broken both lingual cusps off, you know, at gum level.
Yeah.
And they just think, oh, yeah, I'll just get a quick little filling there, $80, I'll be out the door, you know, it'll last me for the next 20 years. That's what they're thinking, right? Mm-hmm. And you have to get them out of that complacent situation so they understand, hey, this is difficult. This is going to take some work. And there's a whole series of techniques you can use as you're examining them that get them out of that complacent situation, that sort of start them worried and concerned about sort of what's going on in their mouth. So that's the, you know, and then you've got to think and get it all straight in your head. So really to say, yeah, if you just get to the end and think you're just going to do a case presentation and that's going to be it, and immediately you're going to get acceptance. No, there's a few steps you've got to build up to before you get there.
And if it's a bigger case, like I'm having this issue myself. Like if I see like a new patient for a new patient exam, obviously if there's, you know, a few like cavities here and there or some small things that need to be done, I'm like quick enough and like alert enough to like put something together on the spot and present it. If it's a bigger case though, and you need that time to like think and and analyze things. How would you approach that situation?
So you're talking about a case that you can't work out and treatment plan on the spot.
Yeah.
Is that what you're saying?
Right okay. Now, yeah. I need to work on my treatment planning.
Yeah, okay. Yeah, that's fine. So the thing with it is, patients are never offended by you saying, wow, this is complicated. There's a lot going on here. I just need to sit and think and work this out. Can I get you back on Friday and we'll talk through what's going on? They're never offended by that. So it's always the best thing just to sort of, if you can't get it all straight in your head, don't just start shooting the breeze and saying, well, we might look at this and we could consider that and we might want to think about this and, all this sort of stuff, which you're just burning up your credibility shooting the breeze. Just say to the patient, this is complicated. There's so many issues going on here. I've just got to work it through and work it all out. Can I see you again early next week and we'll go through what needs to be done? So, and that's the best way. And then go away, get it all straight in your own head. And then when the patient comes back early next week, then you're speaking with real authority, with real sort of conviction, because you've worked it out and you know what you need to do.
That's really valuable. Thank you. Because I do that. I see something and there's a lot going on and I'm trying to work it out as I'm talking to the patient. And it's just like a big mess, right? So I think having that confidence to say, you know what, this is complex. Let me think it over and come back, and then we'll go through a treatment plan together at that time or something. That'd be great.
Yeah. Well, before you start speaking and explaining treatment to patients, there's 4 things you've got to get straight in your head. You've got to get the diagnosis. You've got to know what's going on. The next thing is you've got to have 2 options. Like I said, 2 options in red pill, blue pill. You've got to work those out. Then you need to know the fee you're going to charge. And then the final thing is you need to know any warnings that you're going to say at the end of it, like, if you need to warn them about some aspect of the treatment. So that's your legal thing. So those 4 things. Now, until you've got those 4 things straight in your head, you just got to zip it, really, when it comes to talking about treatment. So if I haven't got those 4 things absolutely straight in my head and a patient says, what's going on? What do we need to do? I say, I don't know. I'm still working it out. That's what I say. I love I'm still working it out. As soon as and here's an interesting one. Like sometimes a patient's there and they'll come in with a dental issue, right? And it may be a little bit complicated. And even though I've been doing it for years, I've still got to think about it a bit. So they're sitting there and I've examined them and I've got the information. I'm looking at the x-rays and I'll say, this is complicated. I just need to think about it for a minute. It's true. Yeah. I do need to think about it. I would just sit there and look at the x-ray. And then all of a sudden I know what we need to do, right?
You've got your 4 things.
So then I turn to the patient and I'll say, I got it. I know what we need to do. And then you talk, right? and the patients, they appreciate the fact that you actually sat there, thought about it, and then all of a sudden you turn to them, I've got it. I know what we need to do. They're sort of like,
you're a hero.
Wow, this is so cool. Whereas if you just start blurting out, well, maybe we could do an implant. Oh, no, that wouldn't work. No, maybe we'll do a breathe. Like if you start doing that, you just look like a fool, Stop it. You don't. You just, zip it until you know what the real situation is. Yeah.
That's awesome. So to review the 4 things, diagnosis, know what's going on. 2 is how you're going to present it. Like options, like red, blue.
No.
The 2 different options.
The 2 options for treating it.
Yep. And 3rd is cost. So you have that straight in your head.
Yep.
And 4 is possible complications or issues that the patient should be aware of before accepting, giving consent, basically.
Yep. Yeah, exactly.
That's perfect. That's so valuable. I hope. So I like how you break things down. It's so practical. And I think that's why people love your courses, because they go in and they get practical information that they can apply the next day. It's not theories to test out. It's like, here's what you should do, 1, 2, 3. It's like doing etch prime bond for filling. It's like reproducible and predictable, right? Yeah. So that's amazing. So just from my side of things, and what I want to talk to you a little bit about, obviously, and I'm a new grad and I've got this, podcast started out now, and I'm creating something on the side. And obviously you've done this for a while now under the Relaxed Dentist sort of brand. So if you don't mind, like for last, few minutes here, just talking about your journey into starting the Relaxed Dentist, and sort of what made you jump into lecturing, and how you sort of started building up that reputation and that clientele, because that's something that I know I'm interested in, and a lot of my close friends within dentistry, we're all trying to like do something outside of dentistry and grow something and leave behind some legacy. So I think what you're doing has been incredible, and you've helped so many dentists. So can you just talk to me a little bit about that? Like, when did you decide? What point in your career were you, and sort of like what steps did you take to get to starting the Relaxed Dentist?
Well, I sold my practice pretty much nearly 9 years ago now. I thought I was going to retire. I was just going to play tennis and drink coffee and all this sort of stuff. But after a short while, that didn't sort of work out, because you sort of, the first 6 months you wake up with nothing to do and nowhere to go, and it's great fun. But after that, you think, I need to do something, So I was very lucky. One of the corporates in Australia had me in, and I was going around looking at underperforming practices. So I'd just go and sit in the corner and watch the dentist work. And I mean, sometimes I'd see dentists who had technical problems with their skills, like they weren't up to speed technically. But almost always the problem was communication. If they were failing in practice, it was because they could not communicate well with patients. And that surprised me, because I'd done all the courses, and it was sort of, it had become over the years second nature to me. But anyway, that was what was going on. They couldn't communicate properly with patients. So I thought to myself, gee, isn't that interesting? That this is such an endemic problem across the profession.
For sure.
All these dentists out there not having the practices they could have because they couldn't communicate. So then I thought, well, why not put together a course? And that's it. Really, it was just to fill a need that I'd seen in the profession.
Yeah.
But one of the great shames that I think happens is that every dentist I've ever met has some unique piece of knowledge, and they've also got gaps as well. And I've got gaps, and but I've got a few unique pieces of knowledge, and they'll just retire or leave the profession, and nobody will ever know the difference. So I sort of had this mission. I all of a sudden I realised I had some knowledge that the average dentist didn't have. I knew that knowledge was incredibly valuable. I mean, how could I retire at 51 sort of thing? So I knew that knowledge was incredibly valuable. So I thought, why not just start getting it out there? And that's really it. So, I mean, if you were wanting to start something up, I mean, you've got to think to yourself, at this stage, I guess you've got your youth and enthusiasm. But then you start getting out there and you start studying, you start delving into areas, and you start going, and that'd be the thing, and then when you've got something unique, and there's so many dentists out there, I reckon they're me too, they just really, you can look at their practice and you can tell, oh, you graduated from, Adelaide University, and, you just tell the way they practice, or you can tell, what their first boss thought, because they just kept doing the same thing. So I'd say you've got to always be experimenting, and I was experimenting with stuff like single visit root canals, and I was doing that years before it was acceptable, right? But I knew it worked, right? Because I did it and it worked, so I knew it worked, but it was like you didn't tell anybody. And now single visit root canals are mainstream, right? The majority, I believe, in North America that have done a single visit, so now they're mainstream, and even mainstream in Australia. We've got endodontists, specialist endodontists who do single, but you've got to occasionally get out of your comfort zone, get out on that cutting edge and try a few things. And with the communication techniques, I mean, I was sort of just constantly experimenting with them and trying new things. And that gives you that broad range of experience, but that special expertise that people might be interested in. If you've just done Me Too the same as everybody else, it's not that fascinating. So I'd say get out there on a limb and have a go and try a few things and experiment, and you fail with lots of things, I mean, but some of anyway.
That's incredible. No, that means a lot. And it's funny that you say that, to try different things, and the fact that you can like go to an office practice and you can tell where that person's from, what school they're from. Because a lot of people just stick to tried and true, right? And they don't try and experiment and learn new things. And that's one thing I heard, like, as a new grad, I've always like heard, and I wasn't sure what that meant. They're like, oh, if you work by yourself, like you'll build bad habits. So what do you think about that? Like, what is that? Is that just like you're doing bad work and you just get used to it? Or does that mean like, what does that mean usually when someone says that?
I don't know what that means.
Yeah.
If you work by yourself, you'll build bad habits.
Yeah. Like if you're like a new dentist and you're in a new practice by yourself, say like you open up your own practice, and you're kind of just like, you're in your own little isolation area, just working, doing your thing. You can pick up and build some bad, like dental habits, like clinical habits. So that's an interesting one I've heard.
Yeah. Well, I'm not sure about that. I mean, I don't think your first couple of years out, you've got the skill. It's hard enough just doing clinical dentistry for the first couple of years, let alone trying to run a practice as well. So I don't know. I think most of us, just start off working for someone else, but I think you might pick up more bad habits from working for someone else, really.
Yeah, you learn their bad habits, I guess.
Yeah, you do need some friends and some confidants, some people, because the problem is you go to a dental meeting, right?
Yeah.
And it's, the people who are standing around at the cocktail hour drinking and carrying on, that's 98% BS, don't you?
Yeah.
So you do need some friends in dentistry who you can actually tell them what really happens in your practice. I can tell you what really happens in theirs. You've got to have a few people like that. And I was very lucky. I had a group of, there was 4 of us, and we could all just pretty much be ourselves, and we didn't have to BS and carry on and go, the world's wonderful, and we've never had a crown that's failed. And
for sure. I think that's so important, and that's partly why I started the podcast, because I went to school in Australia, in Melbourne, and then I moved here, and I didn't have any dental friends. So I stay in touch with my classmates, obviously, back home. But the podcast was a way of reaching out and meeting new dentists who are like-minded, and obviously meeting like mentors and learning from them as well. So I just want to thank you again for coming on the podcast. I think it was really valuable. I think I personally learned a lot, and I'm sure all the listeners picked up a lot of great actionable tidbits of information from you. So for sure, I will put up the relaxeddentist.com so people have access to your website, and they can see what you're offering and what you're all about. And hopefully we can convince you to come out here to Toronto and do a course as well.
Yeah, love to come to Toronto. I'm terribly embarrassed to admit I've never been to Canada. It's a great gap in my world experiences, but it's one that I will correct.
Yeah, for sure. And just wait a few months, because it's been freezing here. So it's enjoy the Melbourne summer, and then hopefully when it's warmer here, we can get you out here.
All right. Thank you. Awesome. Cheers.
Thanks very much, Dr. Acid.